Chers invités, Mesdames et Messieurs, je suis très honoré de vous accueillir à cette session.
Dear guests, ladies and gentlemen, I'm very honored to moderate this session. I am the manager on Upstream services.
Ici, je couvre
I'm covering Northern Africa, Central Africa as well. Morocco has done significant progress in terms of economic growth and social development. During the last decades, the National Office for Security, for Social Security, has played a key role in social security here in protection in Morocco. As a major actor, CNSS had to find a balance between viability and including healthcare services and healthcare coverage. Since 2021, within 22 months, the number of adherents has increased tremendously, and we even tripled this number to 27 million, with a rate in 2022 of medical coverage of about 80%. I would like to start by presenting to you this afternoon our guest, who generously accepted to share with us his expertise and his perspective on this specific point, Mr. Hassan Boubrik, who is the General Director of the CNSS since 2021, who played a major role in standardizing and generalizing the social healthcare coverage in Morocco. Mr. Boubrik, I'm really honored. All those who know about your professional journey can be only inspired from it. My first question is, throughout the last few years, the CNSS has undertaken a number of ambitious projects, and that's the least we can say, combining financial initiatives and social development. We know very well how much this combination can be quite complex. How do you establish your priorities in terms of social investment, and what measures do you put in place in order to guarantee the fact that these investments can attain the expected results? First of all, the CNSS is an operational pillar in social protection. And in this regards, we are in charge of working on a number of regimes, including social protection. We also take full charge of adherence of different employees, providing also numbers to different employees and having contributions from different employees. We have also a mission of inspection and control, to make sure that the declarations done at the level of CNSS are respected. And at the end, we have also all the money associated to retirement, healthcare coverage, and also sick days coverage. So as a managing director in CNSS, we are not investing in reserves, but we are also working on social programs. This excess or these reserves, which are about beyond $13 billion, are invested in a logic which is purely financial, by keeping an eye on yield, and also by taking into account each region. When we take the state, which is actually financing social protection, the state is putting at our disposal a number of means that are important and which allows to provide funding for the social programs. I would like to mention few of them, few important social programs. The first one is about mandatory healthcare coverage for vulnerable populations, for which the state is already paying the contributions. So if a person is not able to pay for his healthcare coverage, the state will do it on their behalf. We also have different social protections for about 4 million households here in Morocco, and we have also other types of social programs that are financed and funded by the state. How can the state make sure that these programs are actually abiding by different priorities and that these programs are going to achieve their objectives? In terms of the global amount, and the state for the budget of 2025 wanted, in fact, to respect an envelope of $36 million on the two programs that are the assurance maladie obligatoire and also the direct social help. How can we make sure that this program is going to attain its objectives? First, by doing a very good targeting, which means the help that was provided by the country before was actually going through diverse programs. Many of them were diversified but not quite consistent. Some of them were providing grants to a number of necessary products, including gas and other facilities. The third one did not, in fact, target people who had that in need. For instance, if we provide grants for gas, then it's only 2 or 3 cars within a household who are going to benefit from this grant, rather than a vulnerable person who will be benefiting from social commuting or transportation. The same thing also goes for people who are in high need. So we had to change our strategy by putting in place what we call the RSU, the Unified Social Register. This is something that allows, in fact, to captivate the number of vulnerabilities and the financial capacity of different households, not only from their revenues. As you may know, in African countries, we have an important share in the informal sector, so we are not apprehending different revenues coming from tax income, but we do it also through a number of expenditures and criteria that are verified. For instance, we will take a look at the consumption of telephone, of cellular data, of electricity, what is the current how is your state of your house. These are a number of elements that allow to give a score to each household, and through this score you are or not eligible to a social programs. For instance, the healthcare coverage is within a particular range of score, and if you are at 9.32, then we will pay the contributions on your behalf as a state, and the contributions will only be paid by the rest of the population. The key word here is that the different attained programs, we need to make sure that they're attaining their objectives, and this is done through proper targeting. Through RSU, we have done a great step towards this direction. Everything about targeting and doing it on the right place. The CNSS in Morocco has also put in place many partnerships in the private sector for different non-profit organizations. What challenges did you face in the implementation of this partnership, and how did you overcome them? This is the first part of my question. The second one is, what is the role of the partners to improve social efficacy, as was described by you? When a decision was here to generalize the social protection within a calendar that was very tight. It was a decision and also an orientation given by His Majesty the King Mohammed VI, God assist him, because in 2 years we had to generalize the AMO, or the mandatory medical care. In 2025 we had to generalize the retirement and the indemnities as well for all those, of course, who have a stable employment. We have also, since we were designated to take full charge of this, the first part of the program, we had a number of operational challenges to overcome. So we had, in fact, to we had a very numerous population, and since the CNSS at the beginning was only for salaried employees, today we are going also to non-salaried employees and vulnerable populations. So just to give you an idea about the number of people that we serve, which has to be multiplied by 3 or 4, the number of coverages had to be from 10,000, 20,000 per day to 80,000 a day. Today we are processing more than 150,000 folders per day. So doing or facing this explosion and this exponential evolution of this activity wasn't so easy to do. And the idea was to provide us with the necessary support and to deploy all the means in order to face different capacities, and also to base ourselves on partners who are private, who can do it. 1 or 2 examples. The first one is the network. We have a network of about 100 120 agencies. We increased it to 173 agencies who were quite insufficient to cover the whole territory. And today we turn towards what we call payment institutions. They are the ones in charge of transferring cash, and which had as an objective different services that they could put at the disposal of the client. So we try to call for these different networks in order to give our services the number or the affiliation number, and also the medical coverage. After that, we had about 3,200 points that are given to our clientele, and this implicated a lot of work, including information systems, putting in place secure processes to make sure there is a good traceability in real time. We also had to have more security in terms of data protection, but today this partnership has functioned so well that more than 93% of the folders that we receive are not only received through our agencies, but through these proximity points, focal points. The second point is about the processing of data, or the liquidation of data, in order to not, in fact, deteriorate the quality of the service. We had to work with an external partner under our supervision, and this was done with other external service providers, which allowed us to have enough agility, which means we can increase our resources to 200 or 300 people in a period of time of 2 or 3 weeks in case of necessity. And of course we have this which functions very well. The reimbursement deadline, which is an indicator of the quality of the service, we moved from, in 2021, from 10 days in the reimbursement of medical folders, and we are today at 8 to 9 days. When we are talking about the explosion of these activities, we are coming in fact to a great expansion. It's quite impressive. You have multiplied your network of agencies times 30, and you have digitalized your whole value chain. It's quite impressive. You spoke about users, and you spoke also about digitalization. So it's digitalization for more agility, and also for a better customer experience. This is what different financial institutions have been doing, which means they are able to go to new levels of usage, which was described as is. When we talk about success, can you please share with us different examples for the contribution of programs in the CNSS, knowing that one of the best ones that you have identified are the ones that you have described, which means improving the experience of clients, satisfying the needs of populations who are in need, and this is quite impressive. We would like to also have your opinion about different examples, including the programs of social protection, and also the economic growth and reduction of poverty in Morocco. It's very difficult to measure the impact of the social programs. The experience of AMO, which is about the generalization, so we need a historical retrospective to measure the impact, and the same thing also for social health or social protection. As I mentioned before, the number of folders which moved from 22,000 to 150,000 folders processed per day. We're not just talking about folders here, we're talking about men and women who were able to have access to healthcare services in an easier way. So this means that the access to medical care shows that we have more than 10,000 people who are able to have access to different surgeries, including cataracts or ophthalmological procedures and surgical procedures, and which sometimes could have a long-term effect. So the impact is real here. We have great figures, real figures, and we have men and women who are behind these figures. So the impact is right here. So in order to be able to measure it in a very good way, we need enough time. We have households that receive a social help from the state. It's a program which is managed temporarily by the CNSS and by the insurance, and we are normally taken care of by the national agency, which was created recently and which has become operational. One of its major roles is to not only assess the impact, but to do it with different populations and to try to see as much as possible how can these programs of social how do they function, and how can we improve them, and how can we make sure that these programs can actually come out of their different vulnerabilities. So it's about helping all of these households getting out of this vulnerability and to have a better life. Thank you very much. We would like to get back here on time for not a very good souvenir, the crisis of, or the outbreak of COVID-19 pandemic. In September 2019, we had a COVID-19 pandemic, and we noticed that there was a great change throughout the world, mostly in Morocco. I think if we go back here to the CNSS, and by facing such outbreak, the CNSS played an important role in taking care of different households, and mostly in providing indemnities as well as social protection. So what is your experience on this? We were all surprised by this pandemic of COVID-19 and its rapidity and its length as well. So the fact that we had to be locked down and facing the situation, Morocco reacted to it in a very good way, and all the international community in an exemplary way, by giving privilege to the health of the citizen and by providing help to different companies and households. So they had to react very quickly through a number of programs by providing direct help, so monthly amounts or monthly indemnities for all those who are working in sectors impacted by the COVID, including coffee shops, restaurants, the museums, theaters, and others. So CNSS played an important role in distributing these benefits or these provisions, and all people who were declared in the month of February 2021 had the right to be part of it and to benefit from it. The reaction was very quick, which means that when people faced a new situation, a situation that's considered to be critical, they had to receive this help, which came on time and which was in fact released on time as well. So what I can remember is the solidarity of the Moroccan population under the instruction of His Majesty the King Mohammed VI, who has spoken about the impact of COVID-19. There were many donations that were provided to including private, public organizations as well as citizens in Morocco in a very short period of time. We are talking about $3 billion that was mobilized for this specific cause. So this was an amazing proof of solidarity within the Moroccan citizens. So in order to preserve economic stability, and according to you, to what extent the African can in fact face social security and work on social security further, and what advices do you want to give them? When putting in place social protection, it's something very important for our countries of the African continent. Why? Simply because today this system organizes and institutionalizes the national solidarity. This solidarity exists here within families and other people, but this characteristic makes that it's actually quite fragile and insufficient. The fact that we had to institutionalize it and that people had to in fact face different problems in life, family problems or other risks and hazards. So we had to, in fact, work on the solidarity aspect, which is important. So unfortunately, in our African continent, we have a level of revenue, of income, which is very low in comparison with Europe or countries in the northern part, which means that the financing and funding of the solidarity, when I say, for instance, I have to pay a contribution and contribute to my retirement when I will be advancing the age, and when, for instance, within a healthcare insurance, I'll have to count on this particular coverage, healthcare coverage. So the fact that the income is low, we have more difficulty because people have to face their primary expenses. So I think we need to go towards constructing these different social protection systems. And if we don't do it by tomorrow, it will be too late, and we might in fact be in a time where we will be in precarious situations and an access which is insufficient to healthcare coverage. Today, we have a great chance, which is a population which is young, and we can still construct many things with them. It won't be perhaps the case if we wait for another 20 or 30 days to invert this demographic clock. If we take the Moroccan experience, these social protection systems are not constructed in a spontaneous way. The first regimes of social protection in Morocco were created at the beginning of the last century, 1927 or 1930, and this is when the majority of them was created at the end of the 50s. After all this time, we were at 40% of the population that was covered and 60% of the population that was excluded, essentially the salaried employees and non-salaried employees. We had at a point of time to take a decision and say we have to generalize the social protection systems, and for this we had three important things to take into account. The first one is we need a vision, and for us this vision was given by His Majesty the King Mohammed VI. We need also a good political willingness and a very tight agenda. The last two things, and I would like to finish on this, is that when we construct these kinds of regimes and social protection, we need to take a look at the financial solvency, which means that we do not want everything we want to make sure that everything is organized before being advanced on this, and we need to take all the necessary precautions, and we mostly need to be attentive in a way that this can become really regular and we can take good decisions, well-informed decisions. From an operational standpoint, we need to succeed in the challenge, because by facing this population that whom you're asking to adhere to a social protection program, and if behind the different provisions are not provided in a convenient way, then you're completely harming the cause you're fighting for. We are coming to the end of this session. I think this session was very rich, and I would like once again to thank you very much, Mr. Hassan, for sharing with us your insight and your expertise in this subject, which is a highly important subject for the African continent. I'm really honored and delighted, and I would like to thank you once again for being with us, and thank you very much to the audience as well. Thank you.